Tonight we'll be discussing on experimental research design. I remain my humble self, Ojo Daniel, Department of Basic Science and Research. ICO for Africa, JOS. So credit, I will be giving a special credit to my able director, Dr. O.O. Taiwo, who is our director now, will make it possible and easier for the development of this slide. So recall, last week, one of our colleagues discussed on observational research design. Please, can someone just give us a brief recap about what you understand about observational research design before we proceed, please? Someone. Master Gideon, can you give us a brief recap about what you understand on observational research design, please? Master Shalom. Okay, let's do it this way. Hello.
Okay, sorry, sir. And from my own understanding, observational research design is like a non-experimental research method, which deals with us observing and recording behaviors of probably the patients, maybe in psychology and sociology in different aspects, sir. That's on my own understanding.
Okay. Can we? Okay. Now, one aspect of observational research design is that you as the researcher or investigator, you did not interfere with the process of the research. You just observe, count, record, and analyze. Are we getting it? Now,
Yes, sir.
okay. Now, we have two broad type of observational research design, which include descriptive and analytical. In the descriptive research design, it is basically divided into three aspects, which include case reports, case series, and cross-sectional. And in the aspect of analytical research design, it involves case control, cohort, repeated cross-sectional, correlation study, and comparative study. So this is a brief recap about what my colleague, Mr. Teslim Adedoja, discussed last week. So we'll be proceeding on today's business. Now, experimental research design, they are also called interventional study. Are we all getting it? An experimental research design is a systematic method used to establish cause and effect relationship between variables. It involves one or more independent variable while controlling other factors to observe their effect on dependent variable. Are we all getting it? Now, in observational studies, they are also called interventional study. Here, the investigator intentionally alter one or more factors to study the effects on the other one. You understand? Now, here the investigator intentionally alter the independent variable to see the effect, to study the effect on the dependent variable. Now, there are so many key factors in which, if you want to perform an experimental design, which you have to put into consideration. One, there is manipulation. You have to have a control group. There is randomization, so as to To minimize bias, there is a comparison group. In the case of this study, we will get to understand it when we proceed, please. Please, if I'm fast, you should let me know, please. Now, in an interventional trial, the investigator decide which subjects are to be exposed. That's which subjects are to receive an intervention and which subjects are to be in a control group, in contrast to the naturalistic study, which is also known as observational study. Are we all getting it? Now, in observational studies, the subject chooses their exposure group by deciding whether to smoke, drink, exercise, work in hazardous environment, be exposed to toxic wastes, breathe polluted air. Now, if you can see, one of the key difference between observational study and experimental study. Now, in observational study, you as the investigator or as the researcher, you don't choose which of the participants or the subjects that will be in the exposure group. You don't also choose which one should be in the control group. In the observational study, they decide to be either in the exposure group or in the control group. You as data or the researcher, you don't have any business to do with that. Are we all getting it? So in this aspect, if an investigator try to intervene, definitely the study is no more an observational study. It has turned to an experimental study. Please, we should take note of the difference. Now, objective of an experimental study. One objective of an experimental study is to provide scientific proof of risk factor. We all understand what a risk factor is. A risk factor is any attribute or characteristic that increase the likelihood of developing a disease or health condition. Now, it is in an experimental study that you can prove that this is the risk factor of what is causing this disease. And efficacy of health service for the prevention and control for community. Now, thing is that it is in experimental study that you can measure the effectiveness of a new therapy and the efficacy of a new therapy. It is in an experimental and do it. In an observational study, you can't do that. Now, experimental study are broadly categorized into two groups. We have the control and the uncontrolled. Now, in the aspect of uncontrolled, now uncontrolled experimental study, the researcher manipulates the independent variable, but does not include a control group for comparison. Now, in the uncontrolled experimental study, the study lacks a standard baseline, making it difficult to attribute observed effects solely in the intervention of treatment. Now, in the uncontrolled experimental study, it is further categorized to clinical trial. In fact, in some other books or articles, it includes preclinical research, phase 3 and phase 4. But in the baseline of this class, we will try to just explain phase 1 clinical trial and phase 2 clinical trial. That is for the uncontrolled experimental study. We have said that an uncontrolled experimental study does not have a control or a comparative group. That is in the case of phase 1 and phase 2 clinical trial. Both phase 1 and phase 2 clinical trial are okay. Okay.
So yeah, other people are also having these issues. I'm using a mobile device. So yes, I'm using a mobile device. So it's clear on my own end. I don't know for other people. Yeah. Please, is any other person having the same issue?
Okay, I think it's
Okay.
a
Sorry, Mr. Ojo. Sir?
I think it's a network issue because even me from
Oh,
my end I can't see the slide. So, but I think it's network
oh,
issue from other this thing. But he can continue.
okay. Mr. Ojo, please, you can continue, sir. Then after the lecture, after the session, you will send us your slides, sir. Thank you very much.
Okay, thank you, sir. Now, we're explaining phase 1. We say that both phase 1 and phase 2 clinical trial are mostly used in pharmaceutical company. Now, in phase 1 trial is when you put about 20 to 80 people as volunteer to evaluate safety and dose range of a drug. From this aspect, you can see that there is no any control group. You just have one intervening group, that is experimental group. You don't have any control group. Now for the phase, and we should all note that in phase 1 clinical trial, it is used to evaluate the safety and safe dose of a drug. Now, in phase 2 trial is when you recruit about 100 to 300 people who require the intervention. Now, let's take for instance now, you are developing a new malaria drug. You want to check the efficiency, effectiveness of the drugs. Now, in this aspect, you recruit about 300, about 100 to 300 people so as to evaluate its safety and its effectiveness of the drug. That is the function of phase 2 trial. And we have phase 3 trial and phase 4 trial. In phase 3 trial, which I say is not included in this slide, it's used for large scale testing. And in phase 4 clinical trial or phase 4 trial, it's used in post-marketing surveillance. When we will get to understand all these things later, please. Now, for the control experimental design, in the control experimental design, there is a control group. That's the difference between control and uncontrolled experimental design. Now, in this aspect, the researcher manipulates one or more individual variable while keeping the other variable at constant to determine the effect on the dependent variable. Now, these studies are crucial. That is the control experimental study. They are mostly crucial in establishing causal relationship between variable. Now, We have three types of control experimental study. Number one is randomized clinical trial, while in other article it is written as randomized control trial. Randomized control trial and randomized clinical trial, they are all the same. The second one is quasi-randomized clinical trial. And the third one is non-randomized clinical trial. Now, in the randomized clinical trial, this is a type of an excuse me, please.
Sorry, sir.
This is a type of experimental study that is considered the gold standard for evaluating the effectiveness of intervention. Now, in an RCT, participants are randomly assigned to either the intervening group, that is the group that are receiving the intervention, or a control group, that is a group that is either receiving a placebo. Now, a placebo, I know we all understand what a placebo is. Hello? Do we all understand what a placebo is?
No, sir, I don't understand what a placebo is. Please, can you explain?
Good. Now, a placebo is a drug or any substance that does not have an active ingredient. Now, let's take for instance, we have chloroquine. Its active ingredients may contain most of this quinol substance, but a placebo does not have that active ingredient that will make the drug to be effective in the system. Are we getting it?
Yes, sir.
Yes, sir.
Thank you, sir.
Okay. Now, in randomized control trial, the researcher usually make a randomization which help to minimize bias and ensure that the two are compared, making it easier to establish a cause and effect relationship between the intervention and outcome. Now, in a randomized clinical trial, we have said that is a gold standard for evaluating the effectiveness of a therapy. Now, we should also note that in the time clinical trial emphasize that all what has been done, there is a control of the intervention. Now, a clinical trial is a comparative. Now, it involves comparing two individual groups, that is the intervention group and the control group, and is a prospective experiment. That is, it takes place, you follow it up, which is mostly conducted in a human subject. Now, there are three steps if you want to conduct a clinical trial. There are three phases in conducting it. One of the phases is the planning phase, trial phase, which involves the data collection and conducting phase. We will all explain these phases one after the other. Now, for the planning phase, it has a protocol to follow. That is, it follows a blueprint. Now, there is a reference population that the finding will be generalized. Now, from the reference population, you select your study population, whereby it is the study population that the experiment will definitely take place, which will also include the inclusion and exclusion criterion. Now, for the inclusion criterion, you understand? For the inclusion criteria are participants that possess the characteristic of what you want to study, and the exclusion criteria are participants that does not have the characteristic of what you want to study. Now, after you have gotten your inclusion criteria, those are the population that you will work with. Now, you give them informed consent. Informed consent is what most researchers use, and it's what most researchers usually use to seek the consent of their participants. Now, informed consent are mostly given for people that are from 18 years and above. Now, for the people that are less than 18 years, informed consent is not given to them. You understand? You just have to seek for their answer, not for their consent. Now, this informed consent divide the inclusion criteria into two. Are we getting it? Now, for the people that consented that they want to partake in your study, that are what we call participants. And for the people that does not consented to be included in your study, they are non-participants. So you work with your participant. Now, these participants, you allocate your treatment by a process of randomization. And randomization is used basically in allocating the participant into experimental and control group. There is a chart that explains all these aspects one after the other. We will get to understand it by using those charts. Now, one of the functions of this randomization is to ensure that the participants that are in experimental and in control group are comparable. That is, they got now, randomization is a method for allocation of subjects to intervention and control group, where each subject have equal likelihood to be assigned to one of the two. Each participant has equal chance to be in the experimental group and in the control group. We have said it that randomization is mostly used to minimize research bias. Now, there are various randomization procedures that are used in clinical trial, but we will discuss three most methods or procedures that are used. We have simple randomization, which assign people to either treatment at random. Now, this aspect of simple randomization. We can take the aspect of throwing a die when you have a participant. We all know that a die have a tail and a head. You can have your participant and you say, okay, which one do you select? Is it the head or the tail? By tossing the coin, anyone that have the head will be in the experimental group, and anyone that have the tail will be in the control group. That is how this simple randomization is done. Now, for the balanced block randomization, ensure that this balanced block randomization is done using participant, a small population or small participant, in which that you want to have maybe a equal proportion of a participant that will be in the control group and those in the experimental group. Now, balanced block randomization ensured balance in the proportion of patients assigned to each treatment within each group, either or block of patients. And it is most example, we all know that hospital is a multi-center study. Now, for the stratified randomization, this stratified randomization is done on subjects that occur in strata. You understand? Maybe you want to look for for a characteristic of participant, but you notice that those participants occur in groups. Now, you use stratified randomization to either categorize them into control and experimental group. Now, for the length of observation, that is, we are still on the planning phase. The researcher do manipulation and follow it up. Now, outcome of interest will affect the length of observation. Now, experimental and control group should be followed in exactly the same manner. Now, you as a researcher, when you are conducting an experimental study, you understand? Those participants in the experiment in the control group, you will treat them equally. You will give them the same time that you are giving those participants in the experimental group will also be the same time that you give in those participants in the control group. Now, you will find it difficult that you as a researcher, you know that, okay, you know that these participants are in experimental group. You will tend to give more time to those people in experimental group. It's not good. That is why in most cases, there is what we call masking or blending, whereby the researcher or the participant will not even know which participant is in the experimental group and which participant are in the control group. That is where we use blending or masking. We'll get to see that aspect. Now, okay, I've even explained this. Now, to reduce observer effect and assessment bias, that is where you use blinding or masking. And we have many type of blinding. Now, the first one is non-blinding, whereby you, the participant, you know the intervention that is given to you. It is mostly used in a community trial. It is mostly used in community trial. And the second one is single blinded. Now, in the aspect of single blinded, the observer, that is the researcher, is aware, but the subject is not aware of treatment assessment. That is, either is in control group or experimental group. Now, that is the single blinded. Now, for double blinded, it is done whereby you as the researcher, the observer, you are not aware the subject that is given to your participant. You don't even know if they are in the control group or they are in the experimental group. Now, for the triple blinded, the observer, the subject, and the data analyst are not aware of the treatment assignment. Now, all this blending of 18 are due to minimize researcher bias, participant bias, and statistical bias too. That's the reason why we use the blending or masking stuff of 18. Now, for the data collection phase, patients should be those who are likely to benefit from the intervention, and those who are likely to comply with the intervention schedule. Now, treatment allocation can be done phased. One, it can be done in a phased manner, whereby for the control group and the in the phased aspect of the treatment, it is done in a 1:1 manner, whereby the control group will accept their own treatment, that is placebo, and the experimental group will also receive their own their own stuff. Now, the second aspect of it, it can be adaptive allocation, whereby this adaptive allocation is mostly used in treatment like all these cancer patients, whereby when a treatment is going and we see that there is a positive impact on it, now we now stop. Now, in the adaptive allocation, where result of an ongoing treatment influence allocation so that the proportion of patients with beneficial treatment is maximized. Now, in crossover design, this aspect of crossover design, when you have your control and experimental group, now you are observing that in the experimental group, now there is a positive change, so as for those people that are in the control group, you know that what you are giving them, maybe the therapeutic effectiveness will not be as much as that in the control group. You just switch them off. Those people that you are giving the experimental thing, you switch them so that people in the control group can also benefit in the therapeutic effectiveness of what you just discover. Now, this is the summary of what we have been discussing in ARC-CT. Now, in ARC-CT, you have your reference population. Now, the first thing, from your reference population, you get your study population. That are the people that you want to work with. Now, from the study population, you do sampling to get your sample. Now, from your sample, you have many, you have your participants. Now, in those people, there are people that will be categorized as inclusion and exclusion criteria, where we have defined what inclusion criteria is all about. Now, inclusion criteria are those sample or population that possess the characteristic that you want to work with. But the exclusion criteria are those that does not have the characteristic that you want to work with. Now, it is this inclusion criteria that you will now offer informed consent. Now, for the people that want to participate, they are known as participants. And for the people that does not consented with your study, they are known as non-participant. Now, you now work with your participant. Now, the process of randomization will be done on participant, so that to divide them into experimental group and control group. Are we all getting it? That's the summary of this ARC-CT. Please, in this aspect, if you have any question, please, you should let us know, please.
Thank you, sir. For now, there's none.
No question from this end, sir.
Can we proceed?
Yes, sir, we can. Thank you very much.
Now, advantage of the RCT, that is randomized clinical trial or randomized control trial, it is a prospective, it's a follow-up. You understand? You follow up. And another advantage is randomization. We have said that the randomization is mostly done to minimize bias, either the researcher bias or participant bias. Now, there is clear temporal sequence. You as a researcher, you know what you really want in the study. And the fourth advantage is the best evidence for causation. You understand? Now, this number 4, now the best evidence for causation. It is in randomized clinical trial that the researcher will beat his chest and say, okay, the cause of this disease is as a result of this. It is in randomized or experimental design, study design, that the investigator will say this disease or this situation is as a result of this effect. Now, some disadvantage of all this randomized clinical trial is it is expensive, either in time. Now, let's take, for instance, in the development of new drugs, some drugs usually take more than 2 years, 3 years for it to be developed, especially new drugs. You understand? And it is expensive in personnel, facility, and it involves bogus amount of money. Now, another disadvantage of this RCT is that those exclusion criterion, those exclusion may limit your generalization of your study. You understand? And another disadvantage of this RCT is that for you to get an ethical clearance, it's very, very hard. The ethical clearance of RCT is, they take it very, very serious. And we know that human behavior may be difficult to control. We all have our negative sides as a human being. So human behavior are difficult to control. Now, the second type of controlled experimental design is quasi-RCT. From the word quasi, it means resemble. We know that in RCT there is randomization, but in this aspect of quasi-RCT, there is no randomization. Now, in the aspect of quasi, it resembles RCT, but the process of randomization is what differentiates the main RCT and the quasi-RCT. Now, in the quasi-RCT, allocation are done using schemes such as date of birth. You understand? You as a researcher now, or as the investigator, you might use date of birth. Okay, for people that their date of birth fall in the odd numbers, should be in the control group, and for the participants that their date of birth fall in even number, should be in the experimental group, that is the other group. So the difference between quasi-RCT and the main RCT is that in quasi-RCT, randomization is not done, and as such, it can result to a bias. Now, for the non-RCT, is another type of experimental design whereby allocation to different group is just done arbitrarily. There is no scientific aspect of you to select your control and your treatment group. There is no any underlying random process. Now, conclusion from non-randomized study subject is subjected to many bias. You understand? What we have been discussing about all this aspect is quantitative study design. And we all know that quantitative study design is divided into two. We have observational and experimental. Now, under observational study, it is further divided into descriptive and analytical study. Under descriptive study, we have case report, case series, and cross section. And under analytical study design, we have cohort, case control, repeated cross-sectional and correlational study. This aspect of observational study, my colleague have discussed it 2 weeks ago. And the aspect of experimental study design, we all say that it involves the control and the uncontrol. Now, for the uncontrol, we have phase 1. We discuss phase 1 and phase 2. For the control, we discuss ARC-CT, quasi-ARC-CT, and non-ARC-CT. Thank you very much. Any question, please? Question, comment, suggestion?
Thank you very much, sir, for this wonderful session. I believe we all learned a lot from today's session. Please, if you have any question, please indicate by raising up your hand.
So, sir, if a person is researching, you said cancer, for researching on cancer drugs, would use an adaptive method
Yes.
under randomized clinical trial. So, sir, I wanted to ask, what of for malaria, and why is it specifically for cancer?
Now, for malaria, that's that life-threatening stuff of a thing. You understand? When you are conducting a research on malaria, okay, for people that have malaria and people that don't have malaria, when you are giving a treatment, their allocation should be in feast. You understand? But in this adaptive method of allocation, it is mostly done in a situation, in a situation or condition that is life threatening. That is where you use your adaptive allocation for your data collection.
Okay, sir. Okay, sir. Thank you, sir.
So, thank you very much, sir, for answering the question. Any other question in the house? Okay, Mr. Titus, please, you can ask your question.
All right. Thank you so much, Sir Gideon. Thank you so much, Mr. Ojo, for the wonderful presentation. My question is concerning the ethical clearance. I don't know. There's a work that I've been doing, and I got stuck at a point where I need ethical clearance. So I don't know, where can someone obtain this ethical clearance? Is there an institution where you would need to obtain the ethical clearance, or is it from the participants you're using for your research, or your this thing? So I really want more light concerning the ethical clearance, sir. Thank you.
Okay, thank you for the question. Now, for the aspect of ethical clearance, you understand, most of the time, like just university teaching hospital have their own ethical committee. You understand? It is the committee that they have their ethical clearance committee. Like this state ministry of health, have you can get your ethical clearance there. Even in ICO, we are still working on our ethical clearance. You can get it in Plateau Specialist Hospital, Jankwanu, and so on and so forth. You can collect ethical. You are working on a person. You can collect an ethical clearance for you from your research participants now. It is mostly gotten from an institution, and those are the institutions that have been listed. You can get it in State Ministry of Health, Just University Teaching Hospital, Plateau Specialist Hospital, Brigham University Teaching Hospital, and ICO. We believe, but in few months to come, we will be giving an ethical clearance for people that want to partake their research. And in most cases, it is being paid. When you want them to give you your an ethical clearance, they will have to review your work and you will pay for it. Thank you.
Okay, thank you so much, sir. Yes, I really appreciate. Thank you so much.
Welcome, sir.
Thank you very much, sir. Please, if you have any question, please kindly indicate by raising your hand, or you can. Okay, I'm coming. Shalom, Mr. Shalom. Please, you have a question.
Sorry. So thank you so much, sir. You did a good job. I really appreciate. But I want to clarify in selecting study population. You said there's you ask for consent, and those who accept or agree who consent are participants. Why those who do not consent are non-participants? So I wanted to confirm. Um, and okay, you also said this consent this consent is for those people below 18 years.
Above 18
Then I
years.
wanted to confirm for those above 18, what will you do?
Now, you turn the question upside down. Now, for the concept, it is for those people that are 18 years and above. Now, for the people that are less than 18 years, that is the minor, you seek for their handset. Handset. You understand? But in this aspect, you have to inform their maybe their parents or their guardians when they have consented. Their parents have consented. Now, when you now come back to those people that those are people that are less than 18 years, when their parents have consented that okay, their children or their minors should partake in the research, now you have to seek for their assets again before you can partake. There are situations that a parent will consent that okay, this person will partake in the research, in the study, but on reaching to the minor, he will not agree. You don't force such participants to partake in your study. Shalom, do you get it?
Yes, sir. Thank you so much, sir.